Welcome to Lifestyle Matters. I'm Marilyn Moore, and today we're at IQ Vision Care with Dr. Barrón, someone that's been on the show countless times, and we're talking about eye exams today, something that is very important, Doctor. It's always good to see you.
Great to see you too, Marilyn. We're here to talk to you about what to expect when you come to visit IQ. So one of the first things we do is we want to get to know you, find out how we can help you, get a really thorough, in-depth history about your eyes and your medical conditions. So you'll spend time with one of my medical assistants or one of our medical assistants here, and we'll interview you and find out how your vision's doing and how your health history is. We'll also get a chance to find out what complaints you have and how we can help you.
And then after that am I getting that big thing on my face?
Well, we go through a series of tests. The first thing we do is we run you through, we've got an EPIC system. It's a state-of-the-art refraction system. It's one of the latest. It's the best technology out there to help determine your prescription. So we definitely put you behind an instrument, get one of those lenses in front of your eyes, and figure out what kind of glasses you may or may not need. Once you do that, you'll meet the doctor. The doctor will examine your eyes and find out what conditions you have and finalize your glasses prescription. After that, after we examine the eyes, we'll also do some measurements that can include even checking your eye pressure. Fortunately, around here, we don't use the standard air puff machine. We actually put some drops in. We may dilate your eyes, so that might make you blurry for a couple hours. And that's just to get a thorough eye exam. If we see any need for testing, we'll send you for testing here, one of the benefits of coming to IQ. And then lastly, one of the doctors will give you a thorough explanation of your diagnosis and your treatment options.
I love it. You got state-of-the-art equipment here. Now, when you have to get your eyes dilated, is that every time you come to, get your eye exam? Is there anything you should be cautious of when getting your eyes dilated?
Well, definitely. A dilation is part of a comprehensive eye exam, and we like to do that on a regular basis. Standards are different for different conditions. So if you're diabetic, hypertensive, or if it's your first time in, we definitely want to get a dilated eye exam. It does change your vision a little bit. You're going to see a little blurry up close, maybe a little bit more light sensitive. We'll give you some special glasses for that. But it gives us a more thorough and in-depth check of the eyes.
And now how long does this whole process usually take?
So an eye exam at IQ typically takes about an hour. So you want to budget a good section of your morning or your afternoon whenever you book your appointment. We want to be thorough and complete here. So that does take time for the doctors to get a good view of your eyes and assess your health and your visual status.
And now, after the appointment, what happens?
So after the appointment, here's what happens is we examine your eyes during the appointment, and then we go ahead and give you a thorough explanation of what our diagnosis is. We let you know what you might need in the way of glasses or contacts. If we need any special testing, we can go ahead and order that, and we can actually do that in-house, and that's one of the benefits of being here at IQ.
Now, after your appointment, do you send them directly over to the eyeglass center? How does that all work?
So definitely after the appointment, we generate a prescription for you. If you need glasses or contacts, we send you over to our optical department. Our optical staff will help you select some of the latest and best eyewear out there. They provide the latest in technology and lenses, and both in glasses and contacts.
That's great. Now, how often do you recommend somebody come in for an eye exam?
I definitely recommend an annual eye exam, especially for children and for anyone over 65.
Okay, so that's once a year.
Once a year. Your dentist is every 2 years. We're once a year.
I'm pretty sure the dentist is every 6 months because I just had to do my checkup, and that's the one I'm like, no. I'm like, can't I just come once a year?
Yeah, but we're once a year, and we're a lot nicer.
Yes, absolutely. Now, during the year, what is some stuff that you can be doing to be protecting your eyes for your next eye exam?
Definitely, make sure you're using sun protection. So when you're outside, sunglasses, wide brim hat. Make sure you keep your eyes shielded if you're going to use any type of safety dangerous equipment. Power tools, working in the backyard. Keep your eyes safe.
Now, I want to talk a little about sunglasses because I think those are so important, especially for people like me who are more light-skinned. I know I get sunburns in my eyes. I mean, how important is it to be wearing sunglasses?
It's definitely important, especially this time of year. It's winter. If you go up to the mountains, snow blindness can be an issue. So sunglasses when you're outside, definitely. If you're fair-skinned or you have a history of macular degeneration, it's one of the things it protects. It also prevents the formation of cataracts.
Now, I know walking in, we were just talking about this, it could be a very big place to walk into IQ, especially in Fresno. So you have created these little cards right here that are, make it easy, right, for someone that comes in.
Definitely, it's a flow sheet to kind of show you what the steps in the process are, so you know where you're at. You don't feel like, oh, well, they just kind of forgot about me. We're going through a system. We'll get you worked up. We'll get you checked out. You'll come see the doctor, and you might go in for some special testing, and then we'll kind of summarize everything we find at your visit.
Now, doctor, how easy is it to make an appointment here?
Well, it's as easy as making a phone call or getting on our website and booking an appointment.
I'm glad we did this, and thank you, doctor, again. And viewers, like doctor said, visit the website, give them a call, schedule an eye exam. You need one about once a year. Don't be like me and wait for every 2 or 3 years. Obviously, not good. Thanks for watching Lifestyle Matters. I'm Marilyn Moore, and we'll see you next time.